Hi, Dr. Sasse here from the Continence Center at Nevada Surgical. I was asked recently a question which is incontinence a progressive disease? And what does that mean? Does a progressive disease mean that it just gets worse over time, or what do we mean by that? So the short answer is yes. In general, incontinence, meaning bowel leakage or bladder leakage, is progressive, meaning that as we age and more time ticks by on the clock, we have a diminution, a reduction that is, in the signaling power of our nerve signals down to the pelvic floor musculature, and therefore the weakness or the lack of coordination that is leading to leakage or incontinence gradually gets worse over time. And this is why all the charts that you may pull up on Google to look at the incidence of incontinence as a function of age just go up and to the right. So in that sense, yes, it is a progressive disease. We think of it occurring in most people at the beginning as being something that occurs in women with coughing or sneezing, so-called stress urinary incontinence. This is very common, however, it then progresses to become mixed incontinence, meaning that yes, the coughing or sneezing still cause it, but in addition to that, there's another form of incontinence that just occurs with flat-out leakage for no good reason, and usually with no warning time or ability to control it. The same is somewhat true on the bowel side or the rectal side. Incontinence often starts as a mild seepage, but it gradually progresses until someone is having frank accidents and needing to wear diapers and have these sort of emergency cleanups occur. So what we like to do is be able to see someone a bit earlier in the progress of this condition. Why is that? It's because we can be more effective at solving the problem and preventing its progression onto such a serious and debilitating condition. As you may know, our focus is the cornerstone therapy of sacral neuromodulation, which is the only long-term proven FDA-approved treatment, which is a minimally invasive, minor procedure that creates this long-term switching on effect of the pelvic floor musculature and the bladder in front and the bowel and back, sphincter function, and all that coordination that has to take place in order for those systems to work properly. Sacral neuromodulation works in 90% of cases, and we think we can boost that to over 90% with our combined therapies that use filler injection technology, pelvic floor exercises, and some additional counseling around diet, fluid intake, and medication. So if you or a loved one is experiencing problems with leakage or incontinence on the bladder side or the bowel side, or the related condition of overactive bladder, call us, make an appointment with us, and let us show you how we can make that better before it progresses to becoming something that's really wrecking your life and interfering with your activities. All right, I hope that's been helpful, and I wish you the best of health.